Hey mama, I'm sure that most, if not all of you know that your baby is surrounded by a thin sac called the amniotic sac, which holds the fluid around your baby, and is attached to the placenta. In order for baby to be born, the amniotic sac will usually tear painlessly to release the fluid inside and to help baby be born easier. This release is called a rupture of membranes. But most mamas might not know that sometimes care providers will want to artificially rupture the membrane or break mama's water to help induce labor or speed up labor. And not knowing all the information you should know about this procedure can create a scenario that you feel nervous or uncertain in. I want to help you feel informed and empowered about this procedure, so in this video, you're going to learn about what an artificial rupture of membranes is, how it's performed, and its benefits as well as its risks, and how it can impact the birthing experience. I'm Bridget, and I'm a childbirth educator and birth doula, and it's my passion to support and empower mamas with the reality that they are built to birth. If you are looking for a way to educate and empower yourself through your pregnancy, birth, and postpartum journey, make sure you subscribe to this channel and then hit the little bell so you can watch all the current videos as well as the ones that come out in the future. So usually mama's water will break when she is in active labor. Sometimes it will happen before labor begins, and other times a care provider will deem it necessary to artificially break it. But before we jump into the amniotic sac being broken, let's talk about what it is. So baby is surrounded by these very thin yet very durable membranes, and there are two layers of them. And inside this sac is the amniotic fluid that baby is floating around in, and obviously your baby as well as the placenta that the amniotic sac is actually attached to. If the sac does not rupture on its own, a doctor, midwife, or nurse might help rupture it by using a tool called an amni hook, which looks a lot like a crochet hook that has a tiny curved hook at the end of it. During a vaginal exam, a care provider would hold onto this amni hook and then gently scratch or tug at the amniotic sac until it tears a little hole in the sac and an artificial rupture of membranes, or Arom, is accomplished. Now, most of the time, if mama is being induced, her doctor or midwife will not try to induce labor by breaking her bag of water alone. Artificially rupturing the water bag is pretty unpredictable when it comes to bringing on labor that hasn't begun yet. Just because the bag is broken does not necessarily mean that mama will go into labor soon after, and there isn't a lot of research showing that breaking the bag of water alone to induce labor is effective at all. Most of the time, if a doctor is planning on rupturing the amniotic sac, they will use it in conjunction with synthetic oxytocin, commonly known as Pitocin, which I talk about in a video that is either already released on this playlist or soon to be released. Aroms are only done if mama already has a favorable cervix, meaning it is soft, it's beginning to thin and dilate. The reason for this is because it means that labor is more likely to be imminent. And also, in order for a care provider to physically do an amniotomy, which is another way to say breaking mama's water bag, then they have to be able to fit a couple of their fingers plus the amni hook into the cervix. More often than not, Aroms are done to help speed up the progression of labor than to induce labor. Now, there are some things you should consider when a care provider starts offering to artificially rupture your membranes. The first thing is that once the bag of water has been released, baby no longer has that protective covering around them from the outside world, which means their chances of infection or infection of the uterus increases, especially the longer that mama goes between having her water broken and when she has the baby. This means you are likely going to be put on a bit of a clock since your care team is going to want to see baby born as soon as possible. Another thing to consider is that artificially rupturing the membrane should only be done if you and your care provider know that baby is well engaged in the pelvis. The pelvis is measured out in stations during labor, and depending on where baby's head is, it will either be somewhere between a -3 station where they're still kind of floating at the top of the pelvis and a +3 where they are well engaged and ready to be born. At about 0 station is when baby's head is engaged in the middle of the pelvis. pelvis. If baby is still floating above the pelvis, performing an Arom can cause what is called umbilical cord prolapse, where the umbilical cord slips under the baby's head as fluid leaves mama's uterus, and their umbilical cord is pressed between their head and mama's pelvic bones. If this happens, baby's supply of oxygen is cut off and puts them at greater risk and often will lead to a C-section that wouldn't have been necessary at that point if mama's water bag had still been left intact. The other thing you should be mindful of is at what point in your labor your care provider is suggesting to perform an Arom. If it is before your labor has begun or during the early stages of labor, before you've reached active labor, when the cervix is about 4 to 6 centimeters dilated, then you want to be really cautious about consenting to the procedure. Research shows us that early artificial rupture of membranes increases the risk of the likelihood of a C-section. So until labor is well established, Arom should really be avoided if possible, which means it's unlikely that you would use this method to induce labor and more likely to speed up labor if you're having an induction or even if you've gone into labor spontaneously and need some help with labor progress. So the benefits of Arom is that in the right conditions, it can help speed up labor without the need for other medical induction or labor augmenting methods such as Pitocin. If baby is well engaged in mama's pelvis, if labor has been established and mama is comfortable and consents to this procedure, it can help bring baby down onto the cervix without the cushion of the amniotic fluid and the amniotic sac being there to help mama to efface and dilate more effectively. This can be beneficial if mama is having consistent contractions and is clearly in the later stages of labor to help move things along. Now, one thing to take note of is that once the water breaks, because there is no longer that fluid padding between baby's head and the cervix, the labor sensations that mama is experiencing will generally intensify. But mamas, it's all about mindset. And if you can welcome those sensations to grow in power instead of trying to push them away, they're going to be so much more effective and you're going to be able to manage them so much better. And it simply means that your baby is even closer to being in your arms. When your water breaks, if you're not already using it, I really encourage you to utilize your de-stressor breath, which I explain all about in this video. That is a must watch if you haven't watched it already. Making the small tear in the amniotic sac doesn't cause any pain in and of itself, but when the care provider is reaching up into the cervix, it can be uncomfortable, especially if they aren't being gentle enough. But most doctors, midwives, and nurses want to make sure that they are being as cautious and gentle as possible. So to begin wrapping us up, the 3 questions I would have you ask when trying to determine whether or not getting your water broken for you is the best decision is my baby low enough in my pelvis to minimize the risk of a prolapsed cord? 2, is there a time frame my baby needs to be born in once my water has been broken? And 3, is there any immediate reason for us to do this? These questions, along with using your brain, which I talk about in this video, will help you be confident in the decision that you are making for yourself, your baby, and your birth experience. Mamas, if your water hasn't broken on its own in labor or your care provider wants to use it as a method of induction or augmentation, I'm confident that you will be able to make the best decision with them, knowing what you know from this video and the guidance you receive from your care team along the way. And I hope that you are feeling confident too. While this method is not typically used at the beginning of an induction, it is often done during the course of one, which is why it's so important to know about it if you are facing an induction. Mama, I want to leave you off on this note. You are wise, your body is powerful, and you are worthy of a beautiful and powerful birthing experience that I know you can accomplish through education and encouragement, which I hope you have found here in this video. So thanks for being with me in this one, and I will see you in the next video. Bye, mamas.